The Isiah Factor Uncensored starts right now.
And welcome to The Factor Uncensored. The pandemic may have more serious consequences than we could have ever imagined. New data is being compared to 2019. It shows this. Take a look at this number. An 800% increase in ER visits to Texas Children's Hospital. The kids who are being checked in, children, are struggling with their own inner demons, mental health issues, including aggression, suicidal thoughts, and attempts. These young kids are the future. So what can be done? Dr. Asim Shah shares the red flags parents out there should look for. So take note tonight. It's just mind-blowing. So what's going on with the children?
A lot of things are going on with the children, Isaiah. First is, since the beginning of COVID, a lot of social isolation happened, which is better now, which is fixed now. But a lot of things which we didn't knew about the kids came to light. Kids were at home for about a year or so. And since they were at home, parents found out that their kids had anxiety, their kids may have PTSD, they may have depression, they may have some other problems. Those things were noticed since parents were at home and kids were at home. So that is one thing. Why they are going to the ER? The reason they are going to the ER is multifold. Of course, in mental health, sadly, not a lot of appointments are available. Not a lot of psychiatrists, psychologists, social workers are available to see them. When that is the case, where would they go? To the emergency room. A lot of them have real emergencies. They are suicidal. Studies have shown, numbers have shown that since COVID, there is an increase about 30 to 40%, even in some states, even in some studies, 50% plus increase in suicidal ideations since COVID, 50%. But overall, it's 30% plus. That is a very significant number. And
are we facing a crisis with our kids in this nation? Because it's not just Texas, not just Houston. This is a trend we're seeing around the corner. More kids with suicidal thoughts, more kids, like you said, isolating themselves.
We definitely are facing a problem and we need to do something about it. Just to give you an example of that problem, that suicide has become the number 2 leading cause of death between the ages of 14 to 24. That was not the case. Now it is. Half of these mental health problems start before the age of 14. A big number. Almost 75% are developed or there by the age of 18. These are big numbers. So all these occur in teenagers, in adolescents. This is a big problem. Problem is we're not doing enough about it. We talk about it, but we need to do a lot about it. Access is a problem. Access is a problem, and access at the time you need it. For example, if somebody needs to see somebody, they don't need an appointment 3 months down the road. They need an appointment within a day, within 2 days, within 3 days. You ask anybody who wants access to mental health, a lot of time they find people who are getting an appointment in multiple weeks, multiple months, and that also sometimes cash and insurance issues and all of that. That's not the access. That's not the kind of access you need. You need access without restrictions and early access. That's
now is part of the problem with access, though, part of your industry where you guys just don't have enough mental health professionals out there?
So it depends on where you are. Like, for example, I work at Harris Health, I work at Baylor. We have plenty of psychiatrists at Harris Health. We are lucky, we provide help, and we see people who don't have insurance. That is not the case in a lot of areas. That is not the case in a lot of places. People don't take insurances, which is very sad. People charge cash, which is very sad. But you're right that overall, there is a lack of providers. Overall, there is a lack of social workers, psychologists, psychiatrists. So yes, this is a big problem. We need to train more mental health providers so that they are there. But we also need to make sure that these mental health providers are there to service people who don't have insurances, who cannot afford them, and that only state, federal government, county can do. You and me cannot do that. So we need to invest, and they need to invest more in providing care to people who don't have money, underserved, uninsured, and underinsured.
What would you tell a parent who may have a child that may be going through a mental health crisis, but they don't quite know what to do? Let's say they have the baseline insurance, medical insurance to see a psychiatrist or a psychologist for the help they need, or even a counselor. What should be their first step if they notice the behavior is odd in their child and they know something is going on there? What would you tell that parent to do, Dr. Shaw?
What I will tell them is that most definitely take them to a mental health professional, whether it is a psychiatrist, psychologist, a social worker, and then let them decide whether they need further help. And these symptoms are very easy to pick. Your child is withdrawn, your child is sad, depressed, not coming out of the room. Your child is acting different than they used to act. So there's something different in the child. If they used to enjoy games, video games, playing outside, mingling with their friends, they're not doing that. That's a difference in the child. If the grades are falling, that's a difference in their child. Anything different from the baseline is something to be concerned of.
All right, Dr. Asim Shah, always good to see you. Some very important advice for parents out there, because this is a serious situation where you see an 800% increase in children seeking mental health care in Houston alone. It's just mind-blowing. Dr. Shaw, thank you for your time tonight.
Thank you.
And make sure you pay attention to your children out there. They may be crying for help or advice. You need to just listen.